We actually do 620,000 pounds of laundry every year.
Kids are naturally curious,
We ask a lot of questions.
but it helps us learn. I'm Ryleigh.
I'm Ricky.
I'm Christy Kuhn, Director of Environmental Services and Diabetes Education at Trios Health. Today we're going to talk about how the supplies come into the organization and how we distribute them to all the departments. Thank you for joining me today. Today we're going to talk about how the supplies come into the hospital and what happens when we need to replenish them.
I have a question about how much people you guys gotta feed, how much supplies you gotta buy to feed all the people in the hospital.
That depends. It depends on the day. Sometimes we have a higher census than another time, but we always have 96 hours worth of food on hand.
Yeah.
And the reason for that is, in case of an emergency and the trucks can't get through to us on the highways, if we have an ice storm and the highways are shut down, we have to have those supplies on hand, not only to feed our patients, but to feed our staff as well.
Do you have to buy all the supplies before you start a new hospital?
Absolutely. When we opened Southridge Hospital, we had to continue having our Auburn campus running while we were getting this campus up and ready to open. So we had to have duplication at each location to a certain extent just to make sure we were ready to roll the first day.
Can you take different items from different hospitals if you're in desperately need of them?
Absolutely. Throughout our community, we share. If something happens and we need a specific product and we don't have it on hand, we reach out to our partners in the community and we share with one another.
How do you know if the person has an allergy when you're ordering food?
We actually have a system and interfaces built in with our patient care side and our dietary side. So all of those things get put into the computer and gets fed down to the kitchen. So when the patient calls to order their meal for the day, they're able to tell not only what they've eaten during the course of their stay, how many calories they've had, the nutritional content, but any allergies they may have, or if they have a restriction for a cardiac diet, a diabetic diet, all of those are built into the system. How much laundry do you think we actually do a year?
A lot.
A lot. We actually do 620,000 pounds of laundry every year.
Whoa.
That would fill approximately 85 semis.
It's a lot.
That's crazy.
It is crazy. But we constantly have supplies coming into the system every day, whether it be medications for our patients that come in Monday through Saturday, whether it be surgical supplies. We have those come in regularly from our management department. Just in our central sterile area where we keep all of our sterile supplies for surgeries, we have over 1,100 individual items. How about this? This is a bonnet that they wear in surgery. How many of those do you think we go through a year?
About 100,000, 200,000.
270?
Actually, we go through about 30,000 of these a year.
Whoa.
How about these guys? These are isolation gowns. We use these anytime we have to go into a patient room where we need to protect both the patient and the staff or visitors going in. 120,000 last year. Now this is one of our masks, and we have about 10 different types of masks within the organization. This is a standard mask that we use for isolation rooms or in our stations throughout the organization, where if we have somebody that comes in that has a cough, they can grab a mask and put that on. Tongue depressors. We have these on our surgical or medical surgical floors, our ER, our clinics. How many of these do you think we go through a year?
Well, I know you have to go through a lot.
70?
300?
20,000. But when you think about it, that's a lot of tongue depressors. We also have our generators. We have a big gas tank out there, a diesel tank. So in the event of emergency, we have throughout the organization, all the critical items are on emergency power. So if our power goes out, we can still run all of that critical equipment for our patients.
With everything that's in the hospital, I bet there are thousands of stuff that you go through.
Well, yeah, when you think about Central Sterile, just one supply area for surgical services has over 1,100 specific items, and it's constantly coming and going, coming and going. So we have another warehouse that we buy the bulk of our supplies from, and they always have a specific level of supplies on hand based on what our usage is throughout the year.
How many washers do you have?
We actually send our laundry out to be cleaned. All of the hospitals in our area do that, and we send them to the same facility.
I was also thinking Like where you guys like have the electricity and all the wires of the, like that house or something like?
Oh yeah, our central plant.
Yeah.
Which is very cool. It's huge. It's actually at the back side of our hospital, which is on the west side, and it houses our chillers, our generators, our diesel gas tank, so it's away from the hospital. We also have for our biohazardous waste, so all of the stuff that comes out of surgery that may be saturated with bodily fluids, all of that has to go into a biohazardous container, and it has to be marked a special labeled telling us whether it's pathology, whether it's regulated medical waste, or whether it's chemo waste. All that has to be packaged up, and we send that out, and they come once a week to pick that up. So we have that at all of our locations as well.
When they do surgery, where do those supplies like go to get cleaned?
Those all go down to Central Sterile, and they actually go down in what we call a dirty elevator. So the dirty supplies come down in one elevator and come into the dirty side of Central Sterile where they begin the processing of them. Then they come out on the clean side and go up a clean elevator back into surgery. So they have to bring it in the dirty side up through, and there's documentation of the whole process, and then out through the clean side.
How many people are behind the scenes, like, do all the work?
Just on this campus, we have over 40 employees that work in the kitchen. And environmental services, our housekeeping team, throughout the whole district, we have over 40 people that work behind the scenes after our clinics have closed, during the stay with the patients that go through and do the daily cleanings in the rooms, or they do the discharges once the patient has gone home.
Where's the laundry kept when it comes back?
We have a linen room down in the lower level, and it comes in on carts. We unload the carts, stock all the floors, and put anything that's left over out of the carts back into the linen room for the next day.
How many types of gloves are there?
There are multiple types of gloves. We have specific gloves that a surgeon may want. We have gloves that are standard that we stock on the floors for housekeeping staff, for dietary staff, for our nursing staff that they need to use when they're taking care of our patients. And then we have specialty areas, and they may need a particular type of glove for whatever procedure.
Who places the orders for different supplies?
It depends what it is. Some units we have that are stocked automatically, and they're called PAR levels. So materials management comes around, does a count, they scan it, that goes into the system, they go back and they pick the orders, load them onto the truck, and bring them to our location. If somebody needs office supplies, say, they go into our computer system and they order those individually themselves. Any item that is not a PAR'd item on the floors, they have specific people in the departments that order those supplies for them. We have one person that does that every day.
Different or same?
We have one person that does it 5 days a week, and then one person that does it 2 days a week.
Pretty good. What kinds of things do you guys send out for washing?
We send out all of our scrubs that are used in surgical services, send out all of our patient gowns, towels, washcloths. We have our mops go out, our cleaning cloths go out.
How many meals does the hospital serve?
Typically it serves about 30,000 throughout our organization monthly. So every day we probably have, just for patient side, 200 orders coming down a day. Well, when you think about it, breakfast, lunch, and dinner, and they may want a snack. And sometimes we do have those folks that are on NPO, so they don't call down, but they are able to call anytime they want, 7 a.m. to 7 p.m.
In the kitchen, where do you guys put all those plates?
They have a rack system, so everything goes through the dishwasher and then gets put on the rack system. So that happens several times a day. Same with the garbage. The garbage has to go out several times a day. The soiled linens have to go out several times a day. So they'll take and tie all the garbage bags, put them in a garbage bin with the soiled linens. They tie those in a separate bag and put them in the soiled linen bin. All of that has to come down and either go out to the compactor for the garbage or in the soiled linen room down in the basement. Ryleigh, Ricky, I'd like to thank you for coming by and talking about all the things that go on behind the scenes and how we stock our hospital and keep supplies on hand.
No problem.
Thank you.